Welcome back to Power Your Life. Here's a very staggering statistic. 11 million children are living with a parent who's in need of addiction treatment. And my next guest has spent his life in and around active alcoholism. Now he's helping others who are battling the disease. Joe Schrank is the founder of Rebound Brooklyn, an abstinence-based recovery program, and here with us now. Thanks for joining us, Joe.
Thank you for having me.
It's my pleasure. So you've been in and around alcoholism, and actually you had your own bout with alcoholism probably many years ago.
Many years ago now. I think I haven't had a drink in 17 years.
Bravo.
And that's it's not an easy thing to do, and it's not an easy lifestyle. It's the right thing for me.
So how did you get out of it? How did you decide one day to finally, this is enough, I'm done?
Well, I don't even know that it's a decision as much as a process. I feel
Okay.
like it very much is a day at a time, which is a cliche, but it's true. And I think that the days pile into months, and then months pile into years, and then you realize you reap the benefits of living life without intoxication. It's better for me, it's better for the people around me, it's better for the community, and then you really kind of make a commitment to it.
And you've made a commitment to other people, really, to help them who, not only the individuals, but the families who are really going through that.
Well, the family is everything.
Right.
The functionality of the family, and we talk about the individual who has the disease or alcoholism, but really it is a systemic problem, and it impacts so many other people around them that the system has to work and has to function for the individual to recover. So we're very focused on families.
And I think it's important because the families involved, just that statistic that we were talking about in terms of the children, what's going to happen and what happens with children who are living with alcohol, not one or two alcoholic parents? What's their future like?
Their future, they're very prone to alcoholism themselves, so the cycle continues, or it's so normalized for them, they choose relationships that are impaired. And so when we talk about prevention and we talk about education, really what we should be doing is intervening on these types of situations so that these children can break this cycle and make choices in life that would include healthier aspects.
Now, alcohol is also the cause of so many deaths, probably a primary cause, and yet it's so under the radar. Why is that?
I have no idea. I wish we knew. It's so woven into our fabric of American life.
Our culture. Right.
It is so part of who we are, the entitlement of the young person to party, and the industry, the alcohol industry, really does not pay the price for the damage that's caused by their product. Most states have not raised taxes on alcohol in many, many years. Wyoming raised taxes on alcohol last in 1935.
Wow.
So it's a big problem that we don't really address. We talk about drugs and we talk about the prescription pill epidemic. We do not talk about alcohol, and alcohol is responsible for more deaths than all drugs combined.
So it's kind of the number one killer.
It's the number one
right,
killer. Not only
right.
the number one killer, but also the collateral damage. How many uninsured emergency room visits are there? Domestic violence. When the rates of alcohol use reduce, all social problems get better.
So do you see that happening anytime soon, Joe?
I see, it's interesting. I mean, I think as some states have legalized marijuana,
Right.
and there are other legal choices for intoxication, it's possible. Not that marijuana is harmless. We don't want to mislead anybody.
Right.
It is absolutely not harmless. However, it seems to be less harmful than alcohol. And so we could see a time in America. Yeah, I didn't think we were going to see gay marriage, doctor, but here we are. So I hope that we rethink drug policy, and I hope that we rethink our relationship with intoxication.
I think that's important. Joe, you have a wonderful treatment program, and what I want people to understand is how do we need to treat people who are going through recovery after actually being in a rehab center or something like that? Oftentimes, we've treated people and made them feel shameful or guilty about what's going on, and obviously that approach doesn't work. It just kind of gets people deeper into that cycle, I believe. So what's the answer?
Well, it's very difficult. I think that the parallel process for the family and the people around them to also have their own support is important. Alcoholism is still shame-based.
Right.
When somebody dies of alcoholism, the feeling is, they kind of deserved it. Maybe not that they didn't deserve it, but they signed up for it. When the truth is, many health issues have a voluntary aspect. Hypertension, obesity. You know, if somebody dies of a heart attack and they're obese, we don't say, well, they deserved that.
Right, or a heart attack.
Or a heart
what-
attack,
right.
or right. And so I don't know that there are any easy answers about how to fix this problem or how people can support somebody, but they can certainly learn about the disease. We can certainly treat it as the health issue that it is. We've tried for generations to incarcerate our way out of this problem and punish our way out of this problem.
That doesn't work.
No, it doesn't, and it's going nowhere.
So Rebound Brooklyn actually has a different approach. You look at it as more of a medical problem.
We do. Rebound Brooklyn looks at it as a medical problem, as a health problem. Most rehab and treatment has been very geared towards behavioral modification, which is part of it for sure.
So, but that's only a piece of it.
But that's only a piece of it. And so we have Dr. Scott Bienenfeld, who's our medical director, and on site 3 days a week. So we really take a medical approach to alcoholism.
And that's effective, right?
It's effective. It is. And recovery is possible. There are, according to SAMHSA, there are 20 million Americans who report themselves as living in recovery. So it's possible. Treatment works. It can be beneficial to the individual, the family, and the community.
Right. So the family, in your treatment center, the family is very much involved too.
The family
in the
is very much
process.
involved. In fact, we require that the family be involved.
Good.
And so we do not have clients or patients who won't participate with the family because it won't work. You know, the outcomes are just not there.
So they need to be involved, they need to be engaged, they need to be committed, and they need
do.
to not feel guilty and shame.
And they need to understand what they can and what they cannot do.
Great. Thanks so much, Joe. It's been a pleasure, and good luck with your program.
Thank you. Thank you so much for having me.
My pleasure. We're dishing up some healthy vegan recipes with Miss Rachel's Pantry in just a moment. Turn on your appetite and stay tuned.